Hey everybody, it's Hermon-Taylor here. Welcome to another daily reset. I'm getting a little bit more tactical and structured with the daily resets. Yes, there's been a bit of a gap since I last filmed one. Apologies for that. I am trying to be more consistent. Life is busy. Life has been really busy recently. Also, rebranding. I'm going to be pushing out my content in the future a little bit more structured, a little bit more consistent under Physical, which is a brand I've had for some time. It's a registered trademark. It stands for physical culture. It's an amalgamation of those two words. I used to do all my personal training and fitness under Physical, and I kind of neglected it over the last couple of years. So I'm going to be revamping stuff and pushing new content out under Physical. The website's on its way, so bear with me on that front. The idea with the content as well is I want to make it less rambly. A lot of people don't mind going on a journey of tangents and a random journey. We're discussing some coaching stuff and some useful things here and there. But it's been a little bit kind of, I guess, self-indulgent in some ways, airing thoughts, etc. What I want to do is make it more useful and more valuable for you, the people who are watching it, and I want to tackle more tactical fitness, nutrition, mindset, and lifestyle and coaching information that you can actually use and that you can apply. And so to celebrate that, to basically draw a line in the sand and use this as a new benchmark episode, welcome to the new daily reset. Probably won't be daily, so I might rename it, but welcome to the reset. And I'm going to be launching a podcast very much later this year or beginning of 2019. I've got a couple of guests lined up. You're going to be excited and interested to hear those first couple of interviews and chats. Until then, I'm going to make some of these shows and some of these episodes with some useful information that you can hopefully take away and solve some problems. Today, I want to talk about three things. Smoothies, protein smoothies, green smoothies. It was purple. I was going to show you this, but I finished it. I drank it all. This was my lunch. There's just a little bit left in there. So I have this conversation with people a lot. So I work with a lot of busy business owners, entrepreneurs, kind of senior executives. Most of my clients are men, but also there are some women as well. Busy parents, busy people in general who do not have a huge amount of time, and they need solutions that work well to help them lose weight, stay lean, build lean muscle tissue, and improve their health, energy levels, etc. I really highly recommend green smoothies, protein smoothies as a secret weapon. Okay, especially if you're trying to lose weight and reduce your body fat percentage, increase your lean muscle tissue a little bit. It's a really useful secret weapon. And if you're not drinking green smoothies, protein smoothies regularly or daily, then you're missing a trick. So if you're on the go, if you're busy, if you regularly say, I just don't have time to eat healthily, I don't have time to grab something on the way to work or on the way to meetings or whatever it is you may be doing, one, that's a bit of an excuse because you do have time, but let's not go down that rabbit hole at the moment. Two, this is a really good tactic, okay? So with a NutriBullet, this is a large NutriBullet cup, I put about that much kale in, pack in lots of greens, a knob of raw ginger, half an avocado. I put a beetroot in, a whole cooked beetroot. I will put in good couple of handfuls of frozen berries, good handful of walnuts, some almond milk, and then 3 scoops of protein powder. I use a vegan protein powder, Revolution Foods Super Protein Blend, because I don't tolerate dairy. I have problems with dairy, but you know, whey protein is superior. You absorb more protein from whey protein, so if you don't have a problem with dairy, I would suggest whey protein. Blitz it up, it takes 5 minutes to prepare. It's a whole meal, that counts as a meal. High nutrition, low calorie, you're getting really good whack of good quality protein, healthy fats, and good carbohydrates. This is a really good secret weapon for people who are busy. They need to get more greens, more nutrition, more nutritional value into their daily diet, and also people who want to burn fat and lose weight. Really good strategy, so use it. Second up, Subscapularis. Okay, recently I've been posting a little bit about shoulder pain and the fact that people shouldn't have shoulder pain. It's not just a natural part of aging. A lot of people have responded and they say they do have shoulder pain. Something that's come up a couple of times with a few clients and people on social media is the subscapularis muscle. Okay, so you have 4 rotator cuff muscles. Subscapularis is the biggest. It's a triangular shaped muscle which originates on the shoulder blade and attaches into the head of the humerus, okay? all of the rotator cuff muscles attach onto the head of the humerus. And the main role is you have a very free moving joint. This is the head of the humerus and this is the rest of the shoulder joint. It's not really a cup like that, but just bear with me. You have a lot of freedom of movement, okay? Lots of mobility and range of motion at this joint. It's a wonderful joint. However, it's prone to instability, okay? If you can't position your shoulder and if you have imbalances, which pretty much everybody does, and it's behind a lot of pain syndromes and injuries. The rotator cuff muscles attach into the head of the humerus, and their job is to help it track properly and stabilize it and keep it in position, basically, so that you have a good axis of rotation. And that just means it's in a good position, it tracks well, and it's safe. The subscapularis in particular can get beaten up if you bench press regularly, if you bench press heavy, if you sometimes don't have the best technique, but also other horizontal pushing exercises, because the subscapularis is working hard to stabilize the head of the humerus and keep it tracking safely. And when you are fatigued or you're using a heavy load, you can overload the subscapularis. It's only a little muscle and it can get trigger points in it, it can get injured, it can be become inflamed, the tendon can become inflamed, and it can be painful. So what I want to do today, like 6 months ago, I felt pain and I suddenly lost a lot of strength when I was pressing and I couldn't work out what was going on. And then I remembered I'd had the same thing in the other shoulder a couple of years ago, and it was subscapularis, and I had some trigger points in my subscapularis and it was a bit gnarly in there. It was painful and it just felt very weak when I was trying to press overhead and in horizontal pressing, and it was quite painful. So I remembered a really useful stretch that I'd learned years and years ago and forgotten about. The subscapularis is really difficult to get into. It's very, very deep and you can't really get into it easily and kind of work on trigger point therapy. With the other rotator cuff muscles, you can get a lacrosse ball and you can dig around and you can hit most of them and you can get some good release, but this is a little bugger. Okay, so this stretch is excellent. You need a broomstick and that's it. Take the broomstick with your thumb down, okay? Put it around the body. Good firm grip on the stick. I want it to sit just off the joint, so just past the posterior deltoid, okay? I'm going to slide the bottom hand down, and then what I'm going to do is I'm going to pull the bottom hand. So I'm going to keep my shoulder back and down. I'm going to keep the elbow open like that, and then I'm going to pull the bottom hand forwards, okay? So it's subtle. I'm going to pull my bottom hand forwards. So I'm rotating the up hand and shoulder into external rotation. Can you see that? So it's quite a small range of motion. I'm just going to pull fairly gently at first. I'm just going to hold, okay? I'm just going to hold that position. And I'm looking for, I can feel a fairly strong stretch right up here, top corner of the armpit, deep where the muscle attaches to the head of the humerus, deep up. Kind of under here, okay? It's difficult to kind of get to and point to. So a couple of things you need to consider is hand positioning at the top. Play around with lower or higher hand position, same on the bottom. If you want more torque, put the hand down lower, okay? And then basically what you're going to do is position yourself, get yourself lined up, and just pull. Bottom hand forwards, push yourself into external rotation, and you should be able to feel quite a strong stretch. Now, if you've got trigger points or any inflammation in there, it can be quite painful. So I would suggest you are conservative. Be conservative, go in gently, and you might find that you don't feel anything at first, and you have to play around with the hand positions, where the stick is, position of your elbow, etc., etc. So you have to do a bit of this. Test, stronger stretch, weaker stretch, no stretch. So I'm playing around with the positioning. But the rules are basically pull this bottom hand forwards and rotate. And I would suggest that you balance out both sides, obviously. A little bit lower down, I'm just going to get my hand a bit higher. Cool. And I'm going to suggest that you hold it for 30 seconds on each side. That feels nice. So that's a very easy subscapularis stretch, really, really useful. If you've been having shoulder pain, shoulder problems, especially if you suspect subscapularis, I would throw in this, okay? Thumb down. pull the bottom hand forwards. I can feel a strong stretch there. It's like right at the top of the header of the humerus, deep into the joint, okay? Really, really good stretch. Throw this in regularly, okay? Keep your shoulders in good health to make sure that there's nothing unpleasant lurking in the subscapularis. If you feel extreme pain when you're doing the stretch, that's not a good thing. You should feel a strong stretch, you should be uncomfortable, but if you feel extreme pain, you need to go and speak to a kind of sports therapist, physiotherapist, someone who can help you, because you might have tears in the tendon or some more significant damage in there. So my phone is about to run out of memory. I've got to kind of download some stuff so I can shoot longer episodes. The third thing I wanted to talk about today was hanging. I wanted to talk about passive hanging and active hanging from the rings, which is another secret weapon for shoulder health. But I'm going to go and sort my phone out, and I'm going to go and shoot another episode on that for you. So I hope that's useful. Green smoothies, protein shakes and protein smoothies. Put some good shit in the NutriBullet, blitz it up, it takes 5 minutes. It's a great nutritional insurance. If you're having shoulder pain, particularly on bench pressing, and deep shoulder pain near the head of the humerus, and you feel a loss of strength and pain, test out the subscapularis broomstick stretch, play around with it, get a good stretch in there, and just keep your shoulders in good health. I'll catch up with you in the next reset episode. Have a good day.